Hello, welcome to another anatomy lesson. It's me again, Myra. This week we're going to be talking about the nervous system. Without further ado, let's get started. The nervous system is kind of like the command center of our body. It tells us what to do and when to do it. So that should be interesting topic for this week. So once again, the nervous system is the body's command center. It is a complex network of nerves that transmit signals between the brain and the body. We have the central nervous system. We have the peripheral nervous system. So parts of the nervous system, once again, are central nervous system, that's the CNS, which encompasses the brain and the spinal cord. We have the peripheral nervous system that branches from the cord to the body. Sensory organs detect light, sound, color, odor, taste, pressure, and heat. Neurons are basic units of nervous system, receives and transmits impulses. Let's see how that works. Sensory receptors detect stimuli and send information to the CNS. So what happens after that? We have afferent neurons that carry the sensory information from the receptors to the CNS. Motor neurons transmit messages from the brain to the muscle to create movement. What does it do? It controls movement, sight, and breathing, balance, coordination. It also manages our thoughts and our feelings. It helps our body respond to stimuli, helps our body maintain homeostasis. We have learned over several of these courses that homeostasis means our body is copacetic. Everything is running right. Our blood pressure is good. Our heart rate's good. Everything's going good. Everything's normal. It also initiates behavior patterns like exploring, building nests, migrating. Also, the heartbeat responds to stress, a stressful situation. So it also tells us, okay, we're in a fight or flight, so we need to up our heart rate. We need to get things going. Our epinephrine's going to be going up high. So it also tells us this is a situation that's very stressful, so we need to plan accordingly, okay? It also helps with our digestion. It also helps in our body processes. Well, what are the body processes? Just two examples are puberty, aging, and also wound healing. What are some conditions? Well, we have Alzheimer's, cancer, cerebral palsy, epilepsy. We have meningitis, which is an infection of the spinal cord. We have Parkinson's, strokes, traumatic brain injuries. What are some of the signs of nervous system conditions? Movement, our coordination changes. We start having some memory loss, pain, numbness, pins and needles in our body. We have mood and behavior changes. We are thinking differently. We're not reasoning correctly. Seizures, tremors. When should we call 911? Well, if we start having sudden vision loss, we start having confusion, slurred speech, that could be a sign of a stroke or TIA, muscle weakness or paralysis on one side of our body, that's a true tell sign of possible stroke. What about treatment? Medication, surgery, counseling, supportive care. What are some of the tests they can run? Well, we can do a spinal tap. That just takes a little bit of the cerebral spinal fluid out of your spinal cord area. Test that for meningitis infection. We can do an MRI of your brain and other organs. We can do a CT scan, a CAT scan of your brain, other organs. Ultrasound can look at your nervous system. Brain activity, we can do a PET scan. Arteriogram, look at the arteries in your brain. We could do an EEG, also known as electroencephalogram. We could do an EMG, which looks at the muscle activity, called a electromyography. We could do an NCV, also known as nerve conductivity. That will just let them see how well your nerves are conducting and what speed. Okay, I'm going to go over a couple of different ones we talked about already. Parkinson, cancer, and Alzheimer's. Cancer can be anywhere, any kind. So we're not going to go really into detail of that. But I am going to talk to you a little bit about Parkinson's and a little bit about the Alzheimer's. Let me just get back over here to my notes. Alzheimer's is also known as senile dementia. It attacks in more than one way: cognitive, behavioral, mood, psychological, and whole body. Okay, so first, cognitive: mental decline, difficulty thinking or understanding. They're confused, mostly in the evening. The behavioral is they can become aggressive, agitated, decrease in the self-care. They don't want to bathe or take care of themselves or shave or change their clothes, brush their teeth, any of that. They have changes in their personality. So maybe they once were just happy-go-lucky all the time, and now they're just mad, angry, frustrated. That's not their norm. That could be a sign. Also, behavioral is they start wandering off. They're getting lost. They getting a car to go to the grocery store they've been to several times, and they can't find their way back, and maybe be just a short distance away, and they can't find their way back. How about moods? Examples of moods, mood changes: they're angry, they're more lonely or loneliness, they just want to be by themselves. And once again, their moods are just all over the place. They're happy one minute, they're bad the next. Psychological examples: they're depressed, they have paranoia, they think something is there and it's not, for example. They're hallucinating. How about whole body? They become restless, loss of appetite, decrease in their muscle movements, and their speech has changed. So once again, I talked about cancer. There's all types of cancer, so we're really not going to get into that, but cancer can come from a nervous system. Lastly, we're going to talk about Parkinson's. Parkinson's is a progressive brain disorder, and it decreases the movement in the body. It is nerve damage, comes from damages of the nerves, okay? Symptoms of Parkinson's are uncontrollable movement, tremors, slow movement, decreased walking, decreased talking, and fatigue. Now, lastly, before we go, I'm just going to turn you around. I'm going to show you what picture of the sympathetic, and then we are going to be done for today. Let me just turn you around. And as you can see, get my little, here is the central nervous system. Central nervous system only consists of the brain and the spinal cord. That's the CNS. The peripheral is everything else, all the way down to the legs. And you can see where these nerves are. Here's the eyes, of course, pupils. They stimulate saliva. This is the brain, the cord. Okay. Lungs, heartbeat, stomach, gallbladder, intestines, urinary bladder, reproductive systems here, male and female. Here's from all the way up, C, T, L, and sacrum and coccyx. This is the sympathetic. So our parasympathetic constricts the pupils, but the sympathetic dilates. So everything inhibits saliva, stimulates saliva, constricts the airway, relaxes the airway. So breath in, breath out. Increases the heartbeat, slows the heartbeat, stimulates the stomach, slows the stomach, releases glucose, stimulates the gallbladder, inhibits the gallbladder, stimulates activity for the intestines to keep our digestion going. Over here, inhibits the activity, contracts the bladder, relaxes the bladder. And then here's our kidneys and adrenals, secretes epinephrine, norepinephrine. We talked about that last week. Same thing. Okay. All right. That is our lesson on the nervous system, and I will see you again soon. Have a good day. Bye-bye.